that?
It's actually pretty amazing. If anybody has not gone by to see it, we don't have signs up yet. That's in the works, but it's coming up. I helped tarp it down, and then I wasn't very involved for a while because of being gone, and then I came back and poof, everything's coming up. It's a garden. So we had last night, because the community garden, it's a joint effort. The Board of Health, the Extension Office, just a lot of different groups have donated. So it's all come together, and we need more manpower. But they had their first harvest. It was radishes, so maybe not one of our highest use crops, but very healthy for people. But it's a start, and if you go out and see it, it's amazing what has been coming up. They have tomatoes growing, lettuces up, just a lot of things going on out there. But we do need more help with weeding, or people that want to work in the garden. There's opportunities for people to get involved. So they could just call out to the Board of Health and they can get you signed up. Or there is actually a website. You do have to go to Decatur County Community Garden. On Facebook is a way you can also sign up. And if you can't work out there but want to help, you can also donate through that. They have a wish list. Last night we had it was a compost talk, and I went not knowing much about composting, but this is a way that people can collect their garden or just in their kitchen waste. It's got to be the right thing, and add that to our composting that we're doing out there. So there's just a lot of things going on with that. So I think it'll be a lot of fun. So
a neat opportunity too, if maybe you live in town and don't have room for a garden, but you still have that interest in it.
Yeah,
so.
Mm-hmm. And the food will be given away. Basically, it's available to anybody that comes and works at the garden. Obviously, is already there and can. We're not quite sure exactly how they think one day a week, maybe when they're trying to give the food away. But of course, as it becomes ripe, is when you have to give it out. But that'll be available to people that work in the garden, but just people in general. We're going to try to post that so that if somebody has need of fresh vegetables, they can come by and get some for free if they can't afford them. And then anything left over will be donated to the Bread of Life for them to use over there.
Very nice. Yeah, I think it's just a fun opportunity all the way around. I'm like you. I was gone a little bit, and I drove by the other day. I was like, oh my goodness, it's a full garden. So very good. So. What other things do we have going on in the health department right now?
Well, one thing we're starting, and it's actually today is our first day. It will start this evening, and it's a walk with a doc. We tried this several years ago, and we just didn't get a lot of turnout, but I think it was maybe the timing. So we're trying a different time of day. We're doing through the week. It's going to be every Wednesday at 5:15. So the hope is that maybe people that get off of work before they go home, they would come to our walk. We're going to base it out of the library. So this is, again, a joint effort with the library, and I think the Extension Office, again, is helping us. And once a week for 12 straight weeks, we will be having a walk, and just 30 minutes right there. We meet at the library, and there's a very short medical talk on some topic, and then we'll walk for 30 minutes together as a group. But the advantage, it's a paved walk, Rebecca Park. They finished it all the way down to the library now, and so it's a very smooth, easy to walk path. And the goal is 30 minutes of walking, but people don't have to walk all at one pace. So I would encourage anybody, even if they think they're not a fast walker, you don't have to be. Just even short amounts of exercise is huge for the benefits for people's health. And that's what we're trying to help people get in the habit, because it's all habit, trying to get yourself a set time, a set thing that you're going to do to get some exercise. But then it's also going to be fun, we think, just because you're walking with a group that you're going to be seeing every week for 12 weeks. And then our goal is to go on after that at least one time a month. Being in Indiana, we'll see how that goes.
How the weather plays into that. We'll go
try
snow skiing, won't we?
But that will start tonight, actually. So June 18th is our kickoff at 5:15 at the library. So.
I think a lot of times people think, well, if I don't do it every day, And it is, you're right, it's a habit. But even if you're not exercising at all and you go just this one time a week, that's still better than not going at all.
It's huge, the amount. And I tried to kind of come up with some statistics, but they were all over the map as how much. But just walking one time a week for 30 minutes cuts your mortality rate significantly. One thing I read was 14% by just walking 30 minutes one time a week. So anybody coming today, you'll cut your risk factors majorly. And the goal is to keep it up then. You know, it's got to be continued. So
tonight's the kickoff.
Yes.
Meet just at the library?
At the library. We'll meet in the, I don't know if they call it the community room there.
Okay.
Just right before you actually go into the main library, there's the room there. And we'll have a very short meeting, kind of go over our program, get people figuring out what they're going to do, and then we'll all go out as a group and walk for 30 minutes.
So fun.
So
yeah.
It will be fun.
Kickoff.
So come on out. So.
Very good. Yes. Very good. Back to school. We don't want to talk about that yet because it's the middle of June, but back to school will be coming up here. Yeah. So immunizations that may be needed, the Board of Health is also able to help with those. Yes,
the Board of Health, that's one of their key roles. They really want to get that word out that they are available to do immunizations. They can bill through insurance, if someone has insurance, but if somebody does not have insurance, they will be provided for free. And, for children, this includes adults also. So, we just really want to keep everybody up to date with their immunization schedule. And, it's not too early to think about going back to school, just trying to get ready for that and get those immunizations done. So they have clinics, and I'm afraid I don't have that time off the top of my head. But they also, if you just call the Board of Health, there is somebody there that can tell you the time they're available. I think they can try to work around people's schedule. Most days they're going to have somebody there that can do vaccines. If someone really can't come other times, they will try to work with you.
All right, good deal. Do you know the phone number?
Oh,
we can Google it though, can't we?
Google that.
I always get it and the extension office mixed up, or I would try it. But it's important to remember to stay on that schedule and keep up to date. And even if you're nearing the end of high school, there's still immunizations that will be due and preparing to go on to college, certain ones that are required. So.
All right. Unfortunately, I'm not the fastest Googler in town either. Get to the website. Okay. So office hours are Monday through Friday, 8 to 4. Closed on weekends. Oh, it says actually here, vaccine clinic 10 to 6. I'm not sure that's up to date. So, and then they don't have the phone on here. So, let me try one more spot. Okay, 812-663-8301.
All right.
That's what's popping up for Dr. Google here.
Okay, love that. So call out there and you can get scheduled and get your vaccines updated.
Mm-hmm.
Very good. Other programs going on?
Well, kind of talking in the back to school mode here. We do have coming up, it's called the Back to School Bash, and that will be July 19th, and that's a Saturday, 11 to 2. We had it for the first time last year, and we're doing it again this year. We had a great turnout, and it was a lot of fun. There's Touch a Truck. It's a real group of just all kinds of different people in the community that would come together to help kids get ready for school. And Touch Truck, I think we had bounce houses, face painting, free haircuts for kids, free sports physicals, immunizations are available right there. It was just a lot of fun. And then the newspaper I know has done backpack giveaway.
Yes.
They've done that for many years. They did that in conjunction with that last year, so they'll be again this year. And those are backpacks for kids going back to school, filled with school supplies all ready to go. So it was just really a lot of fun last year, and a lot of different vendors that were giving out free little things, information. The hospital had a big tent. I'm trying to think who all was there. I was in doing the sports physical, so I didn't actually get to walk around a whole lot, but we had a really good turnout, a great day, so we're really hoping people will take advantage of that.
Kind of a end of the summer party, but also for school prep. So it's and free. That's the best
free,
part.
Totally free. It was really kind of cool to see. Oh, vision screenings. They're also doing vision screenings, I think. But seeing these little kids getting their haircuts was so cute. Just they were so pleased, all ready to go, all spiffed up and ready. So
yeah, and then a new backpack on top of it, and right, and that will be on July 19th. So
July 19th,
okay,
11 a.m. to 2 p.m.
Okay, on that Saturday,
that's at the Board of Health, actually, in the right next to it.
Gonna set up there in the yard, don't they?
And it's right next to the garden, so people will be able to walk back and see our garden.
Yes.
So.
You guys have so much going on.
Yeah, we do.
It's a busy place. I think a lot of people have questions. They say, Dr. McCullough, you retired. And then we see you everywhere. But you're very active with the Board of Health. And maybe describe kind of what your role is with the Board of Health.
Well, my title is, I think, actually medical officer. So each Board of Health has and I believe it's always a physician. I may be wrong on that, but that's works with the Board of Health and just tries to take care of any medical issues. Sometimes they give me a call. Most times our staff is very knowledgeable and can manage things just fine, but there's a doctor available. Certainly if the emergencies came up, I would have to get involved. I would hope I could figure out what to do, but we'll see. But yeah, I enjoy working with the Board of Health. It's kind of fun things. It's like this, I've enjoyed being a physician in the office for 38 years, but there's a lot of things I didn't have time to do, and now I do. So
you're branching out,
yes.
spreading your wings.
Mm-hmm.
Yeah. Any other new things coming up at the Board of Health?
One that I really want to mention because it's coming up next Monday, so it's the 23rd, and we do still have spots available. So it's an ATV safety course, and they are giving away, so that's what we really would like to get people in there for this. It's for adults and kids, so both. And they have free helmets, free goggles, and free gloves
to
give away. So there will be a short, it's not going to be long, but a short safety course and I think it's the DNR that's actually putting that on. And then people at the end of that get the helmet, gloves, and goggles. So I Googled this just to see because I really didn't know how much trouble is there with ATVs. There is 7%, I guess I don't know that statistic, but injuries for the emergency room, I think, visits. 7% were ATV visits in last year. Now, how accurate that is, I don't know, but that's any kind of injury.
Yeah.
Unfortunately, there's sometimes deaths, and there were 49 from 2010 on in the state of Indiana.
Really?
So, and that may not sound like a huge number, but it's devastating for a family.
Yes.
And I've had that experience with a family, unfortunately. So this safety course might have made the difference. You just don't know. I mean, it might have been a fluke thing, but that pretty high rate of just more minor injuries, I think everybody ought to get their kid out for this course if they could. So it's free, and they get a free gift with the helmet, goggles, and gloves. So
what time does that course take place?
So that is 6 p.m.
On Monday
6 p.m.
evening.
This coming Monday. Again, you do need to call the Board of Health in order to get registered for that. So if people could, if you go to the Facebook site, there's a little blurb on there for that, and it's got more information on that and the number to call. So
just so many safety tips because summer is here and we don't always use our heads when we're out there riding. So hopefully it will give a little incentive.
So,
yeah.
Well, and I've never been on an ATV in my life, but I had one of our daughters, she was younger, and she just got on the neighbors just for a second, and in just that short of time, she hit something and bam, went right into the garage right next to her. So it could have been far worse, but that was an accident. But things happen. They move fast.
They do. You only have so much time to think to protect yourself. So that's Monday night, 6 o'clock at the Board of Health. That call to get your spot reserved.
Right.
All right. Anything else on your list?
I do. I still have some other
things.
things.
Keep going.
The Board of Health is starting, they're calling it the Wellness Route on Thursdays. They will be going to outlying towns, so trying to, hit the whole county, really. So it's the always on a Thursday. I don't have the time down, I'm afraid, but they're going to be in St. Paul the first week of the month. Westport is the second. New Point is the third, and then they'll be back in Greensburg for the fourth. But at that time, they'll have weight, blood pressure, glucose, A1C, cholesterol, and triglycerides will be available to be done. It'll be a finger stick, so very quick and easy. And then they'll be able to do birth certificates actually at that
on location.
On location. Now it has to be with a credit card at that point, but when they're out around the county. But
that's so nice, though. Mm-hmm. And being in the communities. Now, will they be at fire departments or where?
I'm afraid I don't know. So that'd be something that, again, you can call the Board of Health. So
that's right. And that starts
I think it's already started. So it's going to be starting. So
it's so great to be able to get out because sometimes people just don't have the resources.
Right.
We all say, well, Greensburg's not that far. But in actuality, if you don't have the resource or the gas money to get here, it can be.
Yeah,
or the ability to drive.
Right.
Or
Well, and lab work is expensive. So if this is a way that people can get some free lab work to just kind of help keep them on course, it's a benefit. And then blood pressure, it's amazing what blood pressure, when we check people's blood pressure, people are totally unaware sometimes how bad their blood pressure is. So
and it's fixable.
Can be an eye-opener. Very easily fixable, yes. So
all right, so that's on Thursdays that they go out and make their rounds.
Yeah.
Perfect.
I guess the one other thing that I have and this is not so much a program as just kind of bragging a little bit and information, but in public health news, infant mortality reached its lowest rate since 1900. And we really think this is due to the increase in public health funding, just different programs, more awareness. But Indiana, our numbers were not good. And so we've had a major improvement. The rate is now 6.3 deaths per 100,000 births, which is still too high, but this is an improvement. And I really want to give a kudos to the hospital has made some really big changes. They have a perinatal navigator is their term, and then maternal health advocate is somebody else. So that's somebody to just help women, not just with pregnancy, but other times of their life with their health. There's going to be some counseling available. So I think you'll be hearing more about that in the future with them, but all those things work together for better maternal health, and that translates into better perinatal for those babies. So
it's really, I think we're really starting to see bridging the networks together so that people are not falling through the cracks and their support is offered.
Right.
It's big moves.
Yeah. Well, and it's got to be available. It's hard for people if it's not close by. That's why the outreach, these navigators at the hospital, I think all those things can really bring it closer to people and where they might really access it. So
it's a very exciting program. Yeah. Excited to see that roll out.
Kind of I would mention too, kind of along with that, and this is again the Decatur County Hospital is doing their health needs assessment. And we really, really need feedback from people. This is your time to be able to say what people think is important about health, what needs to change, what needs improvement here in Decatur County for yourself or your loved ones. So that's something you can go to. I know, again, it's on Facebook. There's posters out there that you can, I think it's a QR code, and you can take the survey. There's probably info on there how you can do it on paper. I think if you just, again, call, the Board of Health could probably pass on info on how to do that, or the hospital, but we really need people's input on that. The more people we have giving us ideas and feedback, the better the results would be.
Well, and I think it's important. People always say, well, we don't have this, or we don't have that. This is your opportunity.
Your time. Yeah, exactly. So if you've had a thought in the past, let us know. So
I know I was in the elevator at the hospital yesterday, and the QR code is in there.
Okay.
So
that's why I knew that was.
Yeah. So if nothing else, just go to the hospital elevator, and you will be able to scan that.
So there you go. So.
I'm not sure how long that's going to be open for. Do you?
I don't know. Okay. I should know, but I'm afraid I don't. But it's a set time. So if people are interested, I would encourage them to try to get that done as soon as they can. So
get it done and wrapped up. Get your input in there.
Exactly.
That's your time. Well, tonight, once again, kicking off Walk with a Doc.
Right.
That's exciting. You'll be walking tonight, I'm guessing.
Oh, yes.
Okay, very good. Now, will you be there every week, or is it going to rotate through different people? Do we know yet?
We don't know yet. I'll be there pretty much every week. There is one week I'll be gone doing a really long walk, and I'm going with our church on the El Camino walk.
Oh, very good.
So I will be walking, but just not in Decatur County. So I will get someone else lined up, but I'm hoping to get other providers involved also. So.
Very good. That's exciting.
Yes.
Good stuff happening. Any other news coming up?
I think that's our main things that I hit today. So.
All right. Once again, immunizations are available. If you have questions, call the Board of Health.
Yes.
And Walk with the Doc tonight and Monday nights ATV. Yes. I think that is phenomenal. That's a great thing. So, well, thanks so much. And you'll be coming back with this every month.
Yes, we'll plan a monthly, and I'll try to bring in other people from the Board of Health that can probably get better statistics and talk about their particular area that they're working on.
Well, we're excited to have you. So thanks so much.
Thank you.
It's 9 o'clock on Tree Country 1330. Up next will be Country Gold.